things that I say from time to time that tends to upset a number of hypnotherapists is that I quite like standardized hypnotherapy interventions. There, I said it. Please stay with me though, because if I just offended or affronted you, I think you may warm to me again if you watch this video through and see what I have to say about this. What I like about standardized protocols for therapy, for example, is that if you employ them in that way, you can make a fairly accurate prediction of the likely success that you'll have with it. And you also do not have to worry about intangible elements such as your own level of artistry or ability. So standardized, evidence-based therapy protocols are therefore pretty much, they're a great leveler, and I wish they were taught more often in hypnotherapy classrooms. Though that would mean that more hypnotherapy trainers would have to actually read some research rather than simply regurgitate what they were taught as an entrenched dogma. But heck, that's something that I've harped on about again and again in other videos here on the Hypnosis Geek YouTube channel, so I shan't do that today. For example, when people ask me about scripts, I tend to say that I think it's best to learn how to offer effective hypnotherapy without needing to rely upon a script. But that some scripts are beneficial, and sometimes learning and reading scripts is beneficial to us. They'll show you how others have worked in order to get results, and you also get to see the exact wording that's used within clinical trials and specific research methodologies. I offer scripts to my students in my classes to help them learn and to see those processes in detail too. I think it's wrong to snootily outlaw scripts, for example. So therefore, you may think that I'm a fan of online therapy interventions that adhere to this kind of standardization, these standardized protocols. And it may surprise you to learn that I'm not that much of a fan of those. No. When I've debated or discussed this subject with fellow hypnotherapists and hypnosis professionals, they tend to think that by supporting the use of standardized hypnotherapy protocols, that I also therefore support the use of gradually phasing out real-life hypnotherapists and replacing them with robots who regurgitate hypnotic scripts, adhering to those same standardized protocols. In the odd case, that may be preferable, However, for the most part, I definitely prefer hypnotherapists to be real and to have face-to-face interaction with clients. You see, evidence does also show across all talk therapies, that a good quality working alliance, a therapeutic alliance between client and therapist, advances the efficacy of the intervention. That is, clients derive more benefit when they have a good working alliance with the therapist. And this is particularly true of hypnotherapy. So, I tend to think that if you offer a standardized protocol that has evidence to support it, derived from randomized controlled trials where the same delivery was used and no working alliance was established, for example, a hypnotherapist ought to be able to raise the efficacy of that intervention as a result of the working alliance. Both are evidence-based principles that can combine for the benefit of the client in therapy, the patient. And therefore, I think more hypnotherapists would be wise to learn and be made aware of standardized treatment protocols and examine quality scripts used in research. But I don't necessarily think that they are the complete answer. There are research studies which have shown that David Burns's book, Feeling Good, from the 80s, outperforms some antidepressant drugs in dealing with depression. Just reading it. If you look online, you'll find apps available offering CBT interventions or other mental health advancement tools, for example. Things like Mood Gym have several 100,000 users, and these and other sources would seem to support the notion that results can be achieved therapeutically without a therapist. I tend to think, though, that better results can be achieved with a therapist. In a study published in the British Medical Journal back in November 2015, patients with depression were assigned to electronically delivered CBT and had just a single weekly phone call with a technician. Over 82% of the study participants failed to complete the modules of the program and remained as depressed as those in the control group. If you examine a 2008 study that compared online CBT with real life CBT, that where a therapist was involved, the results were actually very similar when it came to remission of anxiety symptoms, and led to one of the authors to suggest that online delivered CBT could potentially rival face-to-face CBT. That said, most results from internet delivered therapy do not tend to suggest that results are advanced when the program is guided by a therapist. But I wanted to give a balanced perspective. There are similar studies specifically looking at different therapies, but not so much hypnotherapy. I think that, heck, hypnotherapy, just research doesn't have the budget these days or the money out there. But online delivered standardized interventions may be convenient, may offer up the potential for secure anonymity, and may be able to draw upon research to support the efficacy of the protocols being used. But real life human interaction will often advance the results. Some authors even suggest that the reason so many techniques without evidence supporting them get results in therapy rooms because the client has belief in the therapist, belief in the therapy modality, and perceives hypnosis as particularly powerful. And with that set of factors swaying the results, the therapy results, we could be using a wet fish to the head and deriving some therapeutic success. And with that in mind, just imagine how effective hypnotherapy is truly going to be when evidence-based standardized protocols are then advanced by being applied by a therapist who's able to create a good quality working alliance, is perceived as credible and effective by that client, and so on. Bingo, that is when the magic happens. That's all today. Do subscribe to this channel to get all the updates when they happen. Go visit the website of my hypnotherapy training college. I send you my very best wishes. Goodbye for now.